Thanks for staying tuned. Well, our next stop is the ongoing Rubella and Measles Immunization Campaign in Akwa Ibom State. As immunization and its importance cannot be overemphasized, it's pertinent to underscore new modus operandi as well as initiatives that are vital for child well-being as they grow into adulthood. We'll explore the goals, the coverage plan, and the role of parents and communities in ensuring no child is left behind. Joining us to unpack these issues are our guests for this segment, a Health Promotion Officer for Akwa Ibom State. She is also Director of Community Health Services and State Health Promotion Officer, Mrs. Margaret Etim. Thank you very much for joining us on the program.
Thank you.
And welcome. And we also
Good afternoon, our viewers.
Thank you very much. We also have joining us State Immunization Officer, Mr. David Umoh. Thank you very much for coming on the program.
Thank you for having me.
Well, talking about this campaign that has comments or would be commenting in Akwa Ibom State, I'd like you to bring us up to speed with some background and what it hopes at achieving in the state.
All right, thank you so much. The measles rubella vaccine introduction in Akwa Ibom State is a national program that will be bringing new vaccine, the measles rubella vaccines to the state, and we are at this stage preparing. We've concluded our micro plans. We are now doing a sensitization. Advocacies have been done for people to get to know that measles rubella vaccine, a new vaccine, will be introduced into the states. It had already started in the northern states in Nigeria. Last month, states across the northern part had introduced, and right now they have switched to the measles rubella vaccine. So we in the states, we are preparing that by next year, February, we are going to introduce these measles rubella vaccines and then switch over from measles vaccines to measles rubella vaccination as a routine vaccination in the scheme. Thank you so much.
All right, Mrs. Margaret Etim, I'd like to also come to you, bringing some insights as to why this is critical at this time. Why is it important for children of Akwa Ibom State?
Children of Akwa Ibom State are not exception. Like we said, it's a national program. So the children of Akwa Ibom State are also involved. Reason being that we want to shift from the single dose of measles vaccine given to children at 9 months and 15 months to measles rubella. That is one shot to take care of 2 different diseases. Is that okay?
Okay.
One shot to take care of 2 different diseases. That is the measles and the rubella. And for this to be effective, the health sector on its own cannot achieve this. That's why it needs a concise collaborative effort of key stakeholders.
What are those key stakeholders that you hope at drawing attention?
They are quite enormous. For instance, let me start with, we have the State Ministry of Health, we have the Akwa Ibom State Primary Healthcare Development Agency being the key actors of this campaign. And we need the collaborative support of people like the National Orientation Agency, saddled with the responsibility of creating awareness to the community members. Again, we have the Ministry of Education and the State Universal Basic Education, because the eligible age children are within the area of their jurisdiction. That is the targeted age here. We are looking at 9 months to 14 years, both in private schools and the public schools. Aside from Ministry of Education, we have the Ministry of Women Affairs. Let them speak to women through the different groups that they have, so that these women will be well informed, so that they can avail their the opportunity of being vaccinated by the time the health workers get to the school, get to the communities to be vaccinated.
All right, Mr. David Umoh, I'd also like to come to you. Talk about...
You are just cutting me. Most importantly...
Okay, well, if you want to land.
As a health department, we cannot on our own achieve this public awareness. That's why we are collaborating with the media.
Yeah.
Like what we are having right now going on. We are collaborating with the media because with media, we will have massive public awareness.
All right.
That is why. Thank you.
Okay, from the public health perspective now, I'd like to understand, for the benefit of the viewers also, how important this process is for the beneficiaries and persons that are supposed to participate in it. Is it really important, underscoring what they stand to benefit and the gains of partaking in this particular process or exercise?
Well, thank you so much. The benefit cannot be overemphasized. Measles vaccines, we all know, are safe, effective means of combating infection and disease in our community. So we want to protect our children from measles and rubella viral infections. These are usually highly contagious viral diseases that can spread rapidly across community by hair droplets. And the signs, the sequelae of untreated measles can be devastating in terms of causing deafness, blindness, and even death in some instances. So we want to prevent this. We want our children to be protected from measles, to be protected from rubella, and then have a meaningful life without much mobility and mortality.
All right.
Thank you so much.
Margaret, I'd like to come to you. Importantly, I'd like to know who are the beneficiaries and what is the rollout process, talking about the donors and how this is going to be unpacked generally.
Okay. The beneficiaries of this, as I had earlier said, are children from 9 months old to 14 years. And that is why we are sensitizing caregivers and parents, because when these children are immunized, like the State Immunization Officer had said, they will grow and develop as at when due. They will not be hindered by any form of infection.
When is the rollout?
The rollout is coming up in Akwa Ibom State. Because this is done in phases. The Northern State kick-started it on 6th of October. The Southern States are kick-starting it this time around. And even in the Southern States, we are being divided into first stream and second stream. There are some people that will be starting in January, but Akwa Ibom State specifically will be starting on the 4th of February through 13th February 2026. And why this is so is that right now, emphasis is on advocacy to the key stakeholders, sensitization, massive sensitization of the caregivers, the community, and for them to be well informed. You know, whenever we bring in new vaccines like this, it's always saddled with myths and misconceptions. So it is better for them to be well informed now than be misinformed, especially in this era of social media.
Indeed.
So that is why we've been on air. We are reaching out to churches, traditional rulers, then the different women wing to ensure that there is massive information dissemination to prevent, that's what we call pre-bunking.
Okay.
Pre-bunking. So that by the time we actually roll out this campaign, we won't have all these
A specific rollout date has not been set yet.
No, it has. I've said 4th February through 13th February 2026.
All right.
Yes, that is for Akwa Ibom State commencement, 4th February through 13. And the strategy is adopted for the rollout is that we are going to be using the fixed posts, all primary and secondary health facilities in the state. Being an invasive kind of campaign, that is invasive, it's injection, only trained and licensed health practitioners will go around vaccinating.
So persons
And
who
another
participate have nothing to worry about in terms of risks.
We will use the schools, churches, mosque, motor park, wherever the targeted age persons congregate, we will reach out to them. That's why we reach out to the churches, the mosques, the key leaders. And most importantly, the injection, the vaccine is very safe, free, and is given free of charge.
All right. Thank you. Mr. David, I'd like to talk with you.
Dr. David.
Dr. David, I'm so sorry. Dr. David, there is this aspect. We talk about the myths and the misconceptions. Yep. What are those areas that you feel people should be at ease with when we talk about this new vaccine? Of course, you spoke about misconceptions that could actually arise. What would you say to people in terms of ensuring that they are at ease with what is coming?
Well, thank you so much for the question. We want to allay fear of mothers and caregivers in the community that measles rubella vaccine, just like most vaccines that have been introduced and have been seen to be effective, measles rubella vaccine is effective, it is safe. So I want to implore mothers that as we roll out these vaccines come 4th of February next year, they should avail their wards, their children who are 9 months to 14 years, the opportunity to receive this vaccine and be protected from measles and rubella viral infection.
All right, Ms. Margaret Etim, I'd like to take a parting shot at this point. Reiterate again how important this procedure is for health in Akwa Ibom State and across the Niger Delta region.
For the well-being of our children and our pregnant women in future, because children are women that are vaccinated in future, when they are pregnant, they will not come down with this disease, because this disease will result in what we have as congenital rubella syndrome, which to a greater extent will affect the growth and development of the children. So we want the total well-being of the children of Akwa Ibom State and Nigeria at large through this vaccination campaign. Like we've said, after the initial introduction of the campaign, the vaccine will now be in the normal routine schedule of immunization.
All right.
Thank you so much.
Thank you very much, Director of Community Health Services and State Health Promotion Officer, Akwa Ibom State Primary Healthcare Development Agency, Mrs. Margaret Etim. Thank you for coming on the program.
Thank you.
And to you, Dr. David Umoh, State Immunization Officer, thank you for coming on the program. We appreciate your views.
Thank you so much.
Thank you so much.
Well, that brings us to the end of Niger Delta Today. Catch you tomorrow for another fresh edition. My name is Xavier Robert. So have a terrific afternoon. Bye.